This is Dr. Adam Copeskey from Advanced Rehab and Medical, and hope you all had a great weekend. And so I just wanted to come on Facebook here and tell you a little bit about our topic this week. And so this week was a very good topic. It's about common hip injuries. And while there's about eight or so conditions listed for the hip, I want to primarily focus on one of the main issues that affect our hips, and that is strains of the muscles, primarily around our hip area. And so one of the most common muscles that is injured in the hip strain is this muscle right here on the inner side of our thigh, and it's called the psoas, Ilio Psoas. And what it does is it attaches to our lower lumbar spine and then attaches right here at that proximal area of our upper thigh. And so a lot of times if we strain this muscle, we get a lot of radiating and deep groin pain into this area, and then it also can radiate outwards around to the outside of our hip. Now this injury of the Ilio Psoas tendinopathy or hip strain is very common among athletes that do a lot of hip flexion, as that's one of the primary functions of that muscle. So you'll see it commonly in a lot of athletes that participate in jumping, so a lot of track and field athletes that do a lot of hurdling, to even ballet dancers and a lot of gymnastics. However, one thing I wanted to mention is that even though this injury is very prevalent in athletes, it is also can become an issue in just the average Joes or the normal patients that we see here in the office, and that is because of something called lower cross syndrome. And so typically we have a lot of sitting postures. We're doing a lot more sitting, watching TV, or even at our work because we have a lot of desk jobs. So we're in this prolonged sitting state for upwards of 8 to 10 hours a day, and that can be detrimental over the long term and can predispose us to these strains in that muscle. So what I want to show you is here what's kind of happening when we sit. What happens in this lower cross syndrome, two main components, is that this muscle will become tightened as it's a hip flexor, and then also what's happening is we have a weak muscle in our butt muscles because they're not being activated. And so you can see when I sit down here, that muscle comes into a flexed state, almost to a 90-degree angle. And so if I'm in this position for a prolonged period of time, especially when you're driving long distances, this muscle will become over time very hypertonic and stiff in this position because this is becoming shortened, and then we're not activating our glute muscles back here. And so this is one component of that postural imbalance that we very commonly see that can predispose us to hip strains, because we get all the time patients will come in and they'll feel good after an adjustment, and then over the weekend they'll go spend 8 to 10 hours in a car, and then all of a sudden they'll get to stand up, and then boom, they'll strain a muscle or it'll feel stiff. So one thing we can do is that I want to show is two very effective stretches that can help relieve this psoas muscle. And then also this, what happens is this outer complex of our hip can become tight because the weak muscles, as I mentioned in your glute area, they help to stabilize the pelvis as well as kind of have action to abduct our hip or when I move outward. So if that becomes weak, we start having this pelvic unleveling because now our hip starts dropping in, and we add stress to the groin muscles, the adductors, and then even down to our knee and all the way down to our foot. And so a lot of times when this happens, our outer muscles around the hip, primarily the external rotators with the piriformis and tensor fasciolata, become very tight because our hip naturally wants to move that position back outward to compensate. And so one thing, two exercises I want to demonstrate first off would be two stretches, one to relieve that psoas, and then the second one will be to target the outer hip here in our hip external rotators. So what I want to show first is right here I have a pillow, so you can do it at home. And I recommend doing this, during times of, you all watch TV, so during commercials, because I hate commercials. So, when those commercials come on for about 5 or 6 minutes, this is a great time that you can do that. So what we'll do first is, here I'm demonstrating if you have hard surfaces or you have knee pain. I'll show a modified version of this here in a minute. But if you have a carpet or no knee pain, you can use a pillow or a surface to help aid in relieving that knee pain. So what you'll do is on this affected psoas, you just come down here, and then all you want to do is keep this back leg bent, and then we're just going to lean forward. So this really just is a good stretch, and it'll start pulling, and never go to pain. Always kind of come to where you feel it. So if you have any pain, please stop and don't do it, as you may injure that hip area. So what I like to do is just come here and just till you feel a stretch, and just hold it for about 30 seconds. And then after that 30 seconds, you can fall in a little further and then hold that position for 30 seconds. So, and we'll do like 3 rounds of that. So after that 30 seconds, we'll fall into our last phase where we're really feeling that. And then so up to about, 3 sets of 30 seconds, so about 1.5 minutes. And then when we get done, you can just alternate legs. And then we'll come there. This is just a really good stretch to help take that tension off that these hip flexors, the quads, and then the Ilio Psoas primarily. So that is one great one. And then so also when I mentioned that these tight piriformis and hip external rotators get tight, there's another good one we can have if you have a chair. You can sit down in the chair and then just cross your leg over like this, and then we'll come up underneath our knee and our foot and just lean forward. And when you lean forward, you'll start feeling that pull on the outside of your hip. And once again, just like I did on the knee flexion stretch there with the psoas, you want to go till you feel it, but just stop if you have any pain or discomfort. It should never be painful. And once again here, you'll just lean forward and hold it for a count of 30 seconds. And then after that, just kind of further lean and do the same thing for about 3 sets. Go up to 1.5 minutes. And then you can switch over and do the other side. Now, not only is this a great exercise or stretch for alleviating the hip external rotators, but it also, if you come into this flexion position, for a lot of you that suffer for spinal stenosis or narrowing for degenerative changes in your spine, this will help open up that spinal canal and even help as a great exercise for alleviating a lot of that nerve pain if you have sciatic type issues. So that's those are 2 very great exercises that will target the inner side of our psoas and the outer side of our hip. And now the last thing I want to show is just a strengthening exercise that really targets those glute muscles. Because if we can tie like all 3 of these, the 2 stretches and exercises together, we can allow our body to come back to that natural balance. And it's that postural balance that keeps us out of pain. So what we want to do here is I'm going to turn this chair here. And if you're at home, this is a great exercise. What it is, it's called a single leg squat or a posterior lunge. And so what you'll do is just, because I know if you have balance issues, you can grab onto a sturdy chair or an object in front of you. And what you'll do is you'll just squat to about 30 degrees just until that back leg touches the floor. And then you'll come back up. And you'll do this again and then come back up. And so what we want to do is about 3 sets of 10, primarily if you can, but of course go at your own pace. And if you have discomfort, please do not progress doing this. One thing you want to make note of is to not allow that front knee to go past those toes. Because if we start doing that, we add more pressure on the knee joints, and that can become really detrimental over time and cause some knee pain. So you want to make sure that you're doing this properly, and this is one great exercise that really contracts the posterior chain and those glute muscles, as well as if you have knee issues, it'll help strengthen those quads and hamstrings to take pressure off that knee. So once again, I hope you enjoyed these 3 little tips today, and be sure to grab one of those handouts on the hip conditions. And if you have any questions, like always, please come to me and pick my brain about it. And we hope to see you this week, and have a great day.